Okay, we're continuing with the book Prevent and Reverse Back Pain by me, Pete Rogers, Chapter 7, Inflammation and Leaky Gut. This is page 65 if you're following in the book. Why does inflammation matter? Because inflammation will increase back pain. Why does meat increase inflammation? Well, meat and vegetable oil, they have more omega-6 fat, pro-inflammatory. They also increase the risk of leaky gut. They're also often come in the context of salt, which is a vasoconstrictor, decreasing blood supply to the spine, so they're going to increase ischemia, lack of blood flow. Okay, an omega-6 fat means that there's a double bond at the carbon number 6, counting from the omega end, the methyl group end. What type of bond has the most powerful attractive force? James Bond. Sean Connery, the Scottish guy. Okay. Why are excessive amounts of omega-6 fat bad? By the way, you just get these from animal foods. Omega-6 fats, they lead to increased arachidonic acid in cell membranes, and that has a predisposition to making pro-inflammatory secondary mediators like leukotrienes and prostaglandins. So bottom line is they're pro-inflammatory. Okay, what about endotoxins? Meat also contains bacteria that produce endotoxins, and the high fat amounts in meat predispose to leaky gut. Because of the tendency to cause leaky gut, some of these bacterial endotoxins get into the blood. Elevated endotoxins in the blood is called endotoxemia. When you see an emia in a word, that means it's elevated in the blood. All right, so here's the slide. And basically this shows you normal gut. Normal gut over here, the dietary fiber feeds the good bacteria. So the good bacteria have smiley faces, and they make short-chain fatty acids, in particular butyrate. The butyrate goes into the enterocyte. The gut's called the enteric tract, so the enterocytes are the gut lining cells. Cyte, C-Y-T-E, means cell. And they use that butyrate to make TJs, tight junctions, which then prevent anything bad from getting across the gut barrier into the blood. When you've got a loss of tight junctions due to a lack of dietary fiber, due to the fluoride in the tap water, due to the aluminum in the tap water, due to the glyphosate on the non-organic food, due to non-steroidal anti-inflammatory drugs, due to alcohol, due to emulsifiers in processed food, carrageenan in processed foods, caffeine, excessive amounts of simple sugars day after day. All of those things predispose to leaky gut. Titanium dioxide in a lot of pills, all artificial sweeteners, dishwasher soap. You don't need dishwasher soap if you don't cook with oils. All of those things predispose to leaky gut. Excess high fructose corn syrup, BT corn, non-organic corn. Anyways, when you get leaky gut, what happens? Bacterial endotoxins like LPS, lipopolysaccharide from gram-negative bacteria, or LTA, lipoteichoic acid from gram-positive bacteria, gets across the gut wall, and then it'll get into the blood. When it gets into the blood, it causes inflammation, causes a change in the secondary protein structure of the blood clotting protein fibrinogen from alpha helix, cylindrical, to flat, beta-pleated sheet. Once flat, they'll bind with each other, they'll stack up, and they'll produce, the bigger the molecular weight in aqueous solution, the more likely they are to precipitate, to clot. So you get what are called amyloid clots. Amyloid means that the secondary protein structure has changed, so that's an amyloid transformation, or an amyloid change. Sometimes it's also called fibrinolysis. And that then makes all these little clots, and all these little blood clots, they plug up small arteries. They're typically 2 to 200 microns in diameter. They plug up small arteries in your brain and in your heart and everywhere else in your body. That makes you, drops your energy level, makes you stupid, can predispose you to atrial fibrillation. Douglas Kell and Atherisia praetoris are the ones who've written the most about it, so it's really bad. That's another reason not to eat animal foods. Okay, let's see. We pretty much covered all that. What does fiber do to the stool? Dietary fiber adds bulk water to the stool. It attracts water to the stool. So it makes your feces more like a cow patty rather than, Tootsie Rolls or goat pellets. And that's beneficial because when it comes into your rectum, it's softer, it's bulkier, it's more distended. It stretches your rectal wall. So when the person has a safe time and place to defecate, it's like a reflux. Okay? They sit down on the toilet, on the loo, and the muscles have a reflex contraction. It's effortless for the person, okay? And that's how it's supposed to be. If the stool is dry, like goat pellets or Tootsie Rolls, because the person doesn't eat much dietary fiber, what ends up happening is the stool is dry. By the way, why does the stool sit in the colon? Why doesn't it just immediately come out? And partly, there's a little bit of vitamin resorption going on there, but a big part of it is it's retaining water. It's almost like a reservoir of water in case, our ancestors worried about starvation and dehydration. So you'll notice that as soon as you get home from work at the end of the day, or as soon as you eat a big meal, boom, you'll defecate to make room for the new stuff to come in, and you no longer need to hang on to that as a water reservoir. Okay? But let's talk for a moment about what happens when you have dried out stools. You become constipated and you strain your abdominal muscles. That's called the Valsalva maneuver. Tighten up your abdominal muscles to defecate. And there's back pressure from the Valsalva maneuver. It pushes up into your chest. That causes the upper part of the stomach to pouch into the chest over time. That's a hiatal hernia because it goes through the diaphragmatic hiatus. And then that causes loosening of the lower esophageal sphincter. So you get hiatal hernia with GERD, gastroesophageal reflux disease. You get predisposed to sigmoid colon diverticulosis. Back pressure down in the legs, varicose veins. Back pressure into the rectum, hemorrhoids. Back pressure into the scrotum, spermatoceles, which can cause infertility. Back pressure into the periumbilical region, you get periumbilical hernias. Into the inguinal region, inguinal hernias. Okay, so it does all these bad things. That's abdominal pressure syndrome as described by Dennis Burkitt going back to the 1960s. Okay, and it's associated with other things because the stool's dried out on the right side of the colon. You form little rocks that can obstruct the appendix. They're called appendical lith. Lith means stone. You obstruct the appendix, and mucus-secreting glands from below continue to secrete. That can overstretch the appendix and make it pop. That's appendicitis. That's why meat eaters have more appendicitis than vegans. Okay. All right, and so that's all this good stuff about fiber. Okay. Now, in wintertime, it's good to dress in layers to keep yourself warmer. The only disadvantage of dressing in layers is when you first get home to your apartment, let's say after a long day at work, then it's like your body knows you are home. Safe time to go defecate. All right, you've been holding on to it because you don't want to, do the number 2 at work where you don't like the bathroom and you can't read in there. So anyways, the only problem is your rectum, your colon, it knows it's a safe time to defecate, but it doesn't really understand undressing the layers. So you have to move quickly to remove those layers to make a mad dash for the loo. All right, that's it for Chapter 7. Hope you found that helpful.